We are going to turn a few minutes over to Dr. Mike White from Valleywise Health. He is going to say a few things, and then I will introduce our speakers.
Thank you, Jessica, and for all of those that are joining us tonight online. We greatly appreciate it and appreciate the interest. Certainly, one of our missions as we're forming the next generation of healthcare professionals is truly to make them well-rounded. And as part of our mission with the Creighton University Arizona Health Education Alliance, for which Valleywise Health, Dignity Health, and Creighton University are all members of, we want to make sure we're forming all portions of a person's health profession's career. And to do that, we need to be engaged and centered around how we're doing empathetic healthcare. So we're very blessed to, as Jessica noted, to be joined by Dr. Kerzin and Wayne here this evening to help us guide part of this on our path and give us an opportunity to reflect, on our journey and empathy within our journey. So with that, I'm going to turn it back over to Jessica and to get us kicked off here.
So I want to first introduce Wayne Tormala. He is an advisory board member of the Altruism in Medicine Institute. You may know Wayne from his former work in community action at the city of Phoenix, or more recently from his role as bureau chief at the Arizona Department of Health Services. I am going to turn the time over to Wayne, and after he says a few things, he will also introduce Dr. Kerzin to us. Thank you, Wayne.
Thank you. Good afternoon. Happy to be here. Certainly, I'm not going to say much because we're here to see Barry and listen to Barry's wisdom. But I would say that, it's certainly been well documented that life has been disrupted for probably everybody in different ways. And even before the pandemic, over at the health department, I was creating this campaign to really get into what we call the epidemic of loneliness and isolation. Even before the pandemic, of course, once COVID hit, things escalated quite rapidly. So the need for looking at empathy and empathy fatigue and what that means for us, especially for us healthcare providers, has become very critical. We were talking earlier, we were taping an interview with Barry, and we brought a special guest here too, Dr. Patricia Nez Henderson. We did a 2-hour taped interview on looking at empathy fatigue, self-compassion, how do we take care of ourselves when life is disrupted, and especially from cross-cultural perspectives and looking at how that's defined differently for different populations and for different professionals. But most of us go through this journey where we see suffering out there. And at some point we begin feeling the suffering of others. And when, we go from maybe sympathy to empathy in how we look at the suffering of others. And then when we act on that empathy, we really getting into the world of compassion and self-compassion. The old saying is you got to put your oxygen mask on first before you tend to your neighbor. And certainly for those of us in the healthcare professions, if we don't take good care of ourselves, we're certainly much more limited in what we can do for other people. So getting at empathy, fatigue, self-care, and those kinds of things become even more critical. So without further ado, I want to talk a little bit about Barry Kerzin, who I met, I think about 7 or 8 years ago. He was doing a talk at the Phoenix Art Museum, of all places, and I was there, and he talked for about an hour, then we did a break, and after the break, we were going to do some meditation with Barry, including a walking meditation. But during the break, a doctor friend of mine who I was working with, Ben Barbaro, who some of you might know, he's now head of emergency care for University of Texas in Houston, came up to me and said, Barry really wants to meet you. And I thought, why would the Dalai Lama's personal physician want to meet me? And so what I found out, of course, several weeks later is that my friend Ben told Barry he should probably meet me. So that's how we met. But, and I went up to Barry, and as somewhat of a practicing Buddhist for the last 20 or 30 years myself, approaching the Dalai Lama's physician, I thought, I was getting ready to bow, and Barry comes up and he gives me his arms and says, hey, I'm a big hugger. And so I knew from the minute we met like that, things were going to be pretty golden. And we arranged the next day to have lunch because he was wanting to have more interest in getting into the public health space, where I was the bureau chief at the health department. introducing him to my networks. And so a lunch turned into about a 3-hour lunch. I went home that night before we had lunch, and I told my wife, Sue, I said, I think I just had the best day of my career. Of course, at that point, I had a career of nearly 50 years. So that's saying quite a bit, the best day in my career. I said, I met the Dalai Lama's personal physician. Not only that, but we're going to have lunch tomorrow, and you got to come with me. And she said, no, I can't do that. I don't want to interrupt. Said, no, you got to come with me. You'll love the guy. So Barry and my wife, Sue, and I met along with Garrett Riggs, who was working at Banner at the time. Now he's working, I think, with IHS up in Gallup or somewhere. And we, what normally happens when Buddhists get together and have lunch is, especially over 3 hours, eventually we start talking about issues of death and dying and what does it all mean and all that. And so I introduced or my wife actually did, because she's much braver than me. Told her about our son, who we had lost about, to this date, about 13 years ago, over a sudden aneurysm, unexpected at 40 years old, and talked about how over those years we had his ashes spread literally all over the world because he was a traveler. So whenever we traveled, or friends or coworkers traveled, we gave him some of our son Derek's ashes, and they distributed them around the world. So we got this catalog of all these worldly places with our son's ashes. And after telling Barry that story, we're getting ready to leave. And he says, Barry says to me, can I have some of your son's ashes? And right away it became this great joy and then great anxiety, because my wife and I had an early flight the next morning to go up to Seattle to visit our grandchildren. And I said, yeah, of course, this would be great. But how can we get I got to figure out how can I get my ashes to you? Because we're leaving first thing in the morning. Barry says, no problem. I'll follow you to your home. So to me, that says as much about Barry as I'm about to tell you in terms of his biography, in terms of the person he is, and the person I've come to love and adore, friends, colleagues. I often start presentations with asking people to contemplate on whose shoulders are you standing on to be here today. Each of us today in this room only got here because we're probably standing on somebody's shoulders. Many of us can name many people, whether it's a relative, a teacher, a friend, a favorite author, someone that has really influenced our lives to make the decisions to take us on that journey from sympathy to empathy to acting with compassion and dedicating our lives to helping others. And so let me say a few things about Barry. So Dr. Barry Kerzin is a medical doctor, a Buddhist monk, adjunct professor at the University of Pittsburgh, adjunct professor at Hong Kong University, an honorary professor at the Mongolian National University of Medical Sciences. He's founder and CEO of the Altruism in Medicine Institute and founder and chairman of the Human Values Institute in Japan. With the Altruism in Medicine Institute in 2022, he created a compassion mindfulness app called AmyCare, AIMI-Care, to reduce burnout among healthcare professionals. For 33 years, he's been providing free medical care to the poor, up to high lamas, including His Holiness the 14th Dalai Lama. Barry has completed a 3-year meditation retreat. His brain's been studied at Princeton and the University of Wisconsin in Madison. He's given several TED Talks and authored 4 books. But more importantly to me, he's that guy who said, I'll follow to your home to get your son's ashes. So without further ado, let me introduce Dr. Barry Kerzin.
So I'm very honored and happy to be here with you today. Thanks. It has been a bit of a journey. I arrived yesterday, I think in the afternoon, I forget now, from Tokyo. So I am a little jet lagged. So if I fall over, don't get worried. It's just I need a little sleep. I was debating whether or not to use slides, and since I was told this is a very esteemed group of healthcare students, medical students, and faculty, that maybe it's good to give them some slides. They're probably expecting that. So I have some slides, but I'm going to run through them a bit quickly, because I think what the most important, meaningful time is when we can have a discussion with us here face to face, And we have a large group, I'm told, that are joining us virtually on Zoom. And if we have time, we'll do a little meditation together. And this is a new building and you don't have a clock in here yet. So I have my, so that's what we're going to do. So we titled this moving beyond empathy to compassion. And this is very important because when we talk about burnout, and burnout is really becoming ubiquitous, not only in healthcare, but in education and many areas of our society, people are getting burned out. And the problem sometimes, maybe more than not, is we get stuck in empathy. And I'll explain that. And therefore, we're talking about moving beyond empathy to compassion. So right arrow. Yeah, yes, it's not. Oh, I got it. I got it. Did you do it back there or did mine finally work? Okay, so I'll not working. And I'm pointing it at you guys, so I'm at the machine. Okay, so we've been isolated for 3 years. It's been extremely difficult. I feel like I've been in one of those top loader washing machines being churned around. I had COVID, I had long COVID. I lost my visa in India. I live in India for 34 years in Dharamsala, northern India, in the Himalayas. And it's a long story, but I ended up on a very poor visa. And it ended, and I thought, okay, I'll go back to the States and get a good visa. And then COVID hit, and I had to leave. And for a year, I was wandering from friend's house to friend's house in America. I don't own a home. And so that was joyous to be with my friends, but also difficult. It's been a hard time for all of us. Everyone's pretty much experiencing that. Next slide, please. At the end of the day, what do we remember? We remember what went wrong, don't we? Yeah, getting a lot of nodding heads on this. We forget or don't recognize, don't remember all the things that went well. So my suggestion is remember everything. Even celebrate the things that went well. Don't let it go to your head. You don't need to become arrogant, but celebrate the things that went well. You can also look at the things that didn't go well and, make a plan or, next time we're going to try to do better. But remember the things that went well, okay? This will keep us healthy, mentally healthy. Next slide, please. When we're self-critical, remember that you're valuable. Remember that there's someone, or often many people, that love you. Therefore, you're valuable and you're lovable. This is a rhetorical question, so no hands, okay? How many of you feel you're not good enough? Don't raise your hands, because I know it's everybody here. I know it's everybody here, okay? That was imposed upon you when you were a kid, usually by an adult. Sometimes, they were doing the best they could, but it wasn't the best for you. They said, you're a girl, you can't do that. You're not very coordinated, you can't do sports. You're not very smart, you can't be a doctor. Right? And we heard that once, twice, 3 times, and then we started to adopt it as our own mantra, okay? So remember, it's not your stuff to feel you're not good enough. It was imposed upon you. Therefore, you have every right to let go of it. It won't be easy because you've been doing this probably since you were a kid. But just remembering that, you can have less of an identity to when that comes up, you're no good. I don't feel like I'm good enough. Every right to not identify with that. I don't know who Jessica works for, but I'm going to take her with me. You wouldn't be here. None of you would be here if you didn't have high expectations of yourself. Right? Expectations of ourselves are wonderful. It keeps us inspired, motivated to do better. But if our expectations on ourselves are too high, we don't meet those expectations, what happens? You have magic fingers, yes. There it is. We have a sense of failure and we get depressed. Okay? The goldfish is not going to make it. Did it work? No. Okay. Whoop. But if we slightly reduce our expectations on ourselves, slightly, then we can make the expectation and feel a sense of accomplishment and well-being. Okay? Healthy self-confidence is not putting anybody down, not putting ourselves down, like we talked about a moment ago, and not putting the other person down. Okay? How do we find that place in ourself of healthy self-confidence? So here's where we use mindfulness. And in this context, mindfulness means looking inside in the present moment. What am I thinking? What am I feeling? Just observing your inner life. When you find that you're either putting yourself down or you're putting somebody else down, now you know that's not healthy self-confidence. So you can tell yourself, don't need to be there, putting myself down or putting the other person down. And you have to be persistent to change habits, of course, right? So if you persistently are observing and you're noticing, putting yourself or someone else down, each time you tell yourself, that's not where I want to be. I want to be healthy self-confidence. You can get there. It's worked for me. I'm not always healthy self-confidence, but I'd probably say most of the time. I'm not a real arrogant person. And when I was younger, I had a lot of anxiety. I don't have much anxiety or fear anymore. And I don't put myself down, or rarely. There are some situations I do notice when there's a tendency, and I notice that, and I try to buffer it. But generally, I don't. Okay, these are some of the benefits of, here I said mindfulness or meditation / mindfulness. So this is the other type of mindfulness, which is concentration meditation. Okay, it's reducing distraction. This is a rhetorical question because of time. But my question is, how many of you get distracted a lot of the time? And I know almost everybody would put their hand up, right? That's the world we live in, right? Okay, so to be able to reduce that, to be more concentrated, we gain more mental power. So if you have a difficult DDX, a differential diagnosis, or you're working out a dosage for a child or whatever, if your mind is concentrated, you're going to do a much better job more accurately than if your mind is constantly being distracted. So we do a better job at serving patients when our mind is concentrated, less distracted. These are some of the benefits. I may have a, yeah, I do, oh, where did that go? That was funny. Okay, have a good point. It doesn't matter. First, focused attention. Okay, the more we practice, and I recommend that people do a short session every morning when you wake up. You know, I wake up, sit up in bed, I set my motivation for the day around compassion and wisdom. Then I get up and I brush my teeth, use the toilet. What else do I do? And sometimes I make a cup of tea. And then I go sit. And now I sit for a couple hours. I've been doing it for a long time. But I recommend you sit for a few minutes. No clock, no alarm, just comfortably a few minutes, whatever, yeah. Have a designated place in your home. Tell other people if you share your home with other people, please don't disturb. I'm going to just sit quietly for a few minutes, or you can tell them you're meditating. And we'll do a meditation together, and that's the one you can do every day. Okay. So focused attention, calm mind. People often tell me when they're around me, particularly when they're close by, they say, oh, you're kind of calm. You don't seem to have a lot of fear, anxiety. That's my feeling also. You develop more calmness. And as a result of focused attention and being more calm, you learn better. Okay, you have less junk there. Okay, it's more clear, better learning environment. Broad perspective. You can see more because there's less garbage, baggage, out there. Okay, you have more clarity. You can see more, broader perspective. And therefore you make better decisions. And this is why now the professional athletic community, the business community, and slowly the healthcare community is turning to mindfulness to try to reduce distraction and have better learning and a better efficiency. And I might add, when you throw in compassion to the mix, you develop it faster and better, or you enhance it, because we all have some compassion, but you enhance it more. Also, some improved health. This is both physical and mental. I have a couple slides to show physical improvement. Has to do with the immune system, as we all know. Has also to do, there's some pilot research looking at the telomeres on chromosomes and looking at, because telomeres have an association, not causal, but an association with longevity. Okay. And meditation seems to help that process. I'll show you that in a few slides. Also, it obviously helps with depression. I have a slide on that. Good research showing that it helps with reducing recurrence of depression and many other health benefits. How old can you teach your kid to meditate? These are 8-year-olds, third graders. This was outside of Seattle, Washington, a couple of years ago before COVID. And they had a wonderful principle that was, that part of their program was learning how to give, how to be generous, how to be kind, also how to sit quietly. They didn't call it meditation, but it was meditation. Yeah. And they were great at it. I wanted to take some of these kids home. So Jess, we're going to have a group of us. There was some work 10 years ago-ish at University of Wisconsin, Madison, looking at long-term meditators. And the question they asked was, are the brains of these people the same or different from others? Okay. They did functional magnetic resonance, and that's me coming out of 2 hours, I think it was 2 hours inside the scanner. And as you know, it's very loud, very disturbing. But that's a genuine, that's not a polite or a social face. I was actually happy because I got some time to meditate. They had us do 3 different kinds of meditation. One was what we're just talking about, focus or concentration or shamatha. The second was, they called it open monitoring. It was a term they developed. It's basically where everything is wide open, but you're not sticking on anything. Like that. And then the third was that with compassion. Okay. So on the fMRI data, they found that the long-term meditators and the criterion for entrance was 10,000 hours meditation experience. Some people had 40, 50, 60,000 hours. Small group of people, I think about 11 or 12 finally were invited in. And this is they found that on the fMRI that the prefrontal cortex, which you see in yellow, which is under your forehead, a big part of the cortex in the front part of the brain, was not only bigger anatomically on functional fMRI imaging, but also on blood flow, the functional part, the F part, was increased, presumably more activity based on increased blood flow to the prefrontal cortex. The prefrontal cortex is sometimes called the executive, what I call it here, executive center, executive network. It's kind of the highest level of thinking, okay? These qualities are not exclusive, but primarily happen in the PFC, the prefrontal cortex. You can see them: planning, reasoning, imagination, creativity, a sense of who we are, but not identity, pro-social behavior, good behavior, and compassion. Okay, these are some of the qualities that happen in the PFC that are enhanced, presumably enhanced, because the PFC is larger and more active by blood flow in long-term meditators. Then they did electroencephalography, EEG, and what they found, I think this is me. Yeah, this is me, and I'm meditating here. And they put, normally, I don't know, some of you guys may be neurologists, but I think it's 28 leads is the clinical one, I believe so. This is 56. Sometimes they use 112 for research purposes. So looking at more precisely at areas of the cortex. And this is an actual, this is real data. And what they're looking at here is time 0 here when we're told to meditate. So you can see before and then after we meditate. And what happened to us, you have these huge, patterns. And first they thought this was some kind of artifact. Maybe these are intense long-term meditators, their jaws clenched or their scalp muscles are a little bit clenched. And they worked hard and they dismissed that. That was not correct. And they determined that it was actually coming from the cortex. And then what's the meaning of these? So these are gamma waves, high intensity, high amplitude, and they come short, so high frequency, okay? Gamma waves. Normally, when we study brains, normal brains, people that are ruling out disease or people that have neurologic disease, we rarely see gamma waves. And if we do, we don't pay much attention to them. These are bursts. You can see that it's going for quite a while the long-term meditator is still meditating. And they happen throughout the cortex, all the different leads. What they think is this. The gamma wave bursts reflect the number of neurons firing in synchrony, suggesting a large-scale coordination of neural networks. It may now just be entering the neurology textbooks, but as of COVID, it wasn't in the textbooks yet. So it's new stuff. It's all been published many times in PNAS, the Proceedings, the National Academy of Sciences, in Nature and Science. The best quality English language, peer-reviewed, journals for this kind of stuff, okay? I want to show you a couple little research things, just, to whet your appetite, but I don't want to dwell on them. I want to get to the discussion. This is some research, training compassion. I think it was a 6-week program. They had 2 groups. Did I say? Yeah, 6-week program. It's written there. Sorry. And one was compassion training, and the control group was health education. Okay. Next slide, please. Oh, no, I have it. Yeah, sorry. So then they stressed everybody. It's called the Trier Social Stress Test. Some psychology people know this. Doctors usually aren't familiar with this, TSST. Basically, you put a microphone in front of the person's face and you ask them to talk to 1,000 people. So most people start going, oh, get nervous, right? That's the stress, okay? So here we're looking at interleukin 6 on the y-axis, IL6. And it's a whole system. It's not that clear, but it's roughly correlated to inflammation. So better health means less IL6, less inflammation. And as we know, more and more chronic diseases are now being at least associated, some causally associated, but mostly associated with chronic inflammation. So having lower IL6 is healthy. And this is on a logarithmic scale, and it's how much meditation we do on the x-axis. More meditation, less IL6. Remember, it's logarithmic, so it's much greater reduction than you see here. It's not linear, but you can't draw a logarithmic scale, right? So yeah, that's one I wanted to show you. And the second is coming. There it is. So this is cortisol. A y-axis is serum cortisol, okay? Related to stress, right? And on the x-axis is the time after they were stressed with a microphone. Okay. And the group on the top line is the control group that got the health education, the squares. And the lower line, the circles, are the folks that got the compassion training. And this is showing in that window up to about 30 minutes after the stress, and this is statistically significant, lower levels of cortisol in the compassion training group. This is research replicated several times, done by a group in Oxford, Seagal, Mark Williams, and one other guy who just, I forget his name, one other doctor, Mark Williams, Seagal, and forget, and University of Toronto. Okay. And here there are basically three, this is done with people with depression. So everybody in this group has depression. Okay. Everyone studied. Three groups were looked at. One was the group you can see in red, mindfulness-based cognitive therapy, which is basically a concentration kind of meditation. And then one that got medication for depression, SSRIs, selective serotonin reuptake inhibitors, you know, the Zoloft and Prozac and all the newer forms of that, okay? And then third was, in green there is the placebo group. And what we're looking at here is survival. And survival means no recurrence of depression, okay? They went out almost 2 years, I think just about 600 days. It was nearly a 2-year study. What they found was there was only a 20% recurrence of depression in both groups that got medication, SSRIs, and who were practicing meditation, who were trained, taught, and then started practicing meditation. These are not long-term meditators, right? People with depression. And the placebo group that got neither was the opposite. 80% of them recurred. Their depression recurred in that two-year window. It's been replicated. It's very good research. It basically says that concentration meditation is just as effective as our medications, our SSRIs, okay? Okay, this is the physical benefits. So this is early pilot stuff, no conclusions yet, but it's suggestive that meditation can help keep our telomeres long. Those are the ends of the chromosomes, which is associated not only with longevity, but reduction in age-related chronic disease. That's important too, okay? And here's what it happens. So this is normal aging. Pay attention. I'm gonna, you know, these are the telomeres, right? This golden stuff, the tips of the chromosomes. And this is the enzyme called telomerase that kind of cleans up all the broken fragments of DNA in the telomeres and keeps them long. So telomerase is good stuff. So watch closely what happens with age. You'll see the telomeres will get shorter and the telomerase will reduce. So we're less effective at cleaning up the broken fragments of DNA, and hence we cannot maintain long telomeres. That's the normal aging process. So watch closely. Sorry, nothing happened yet. I'm trying to get this thing to work. There it is. Did you see? Telomeres got shorter and the telomerase got less. Back. Yeah, here, do it again. There, see it? Watch it again. Get older. Yeah, more, okay. Now, good. So this is the group in the black bar, lower right side, right? They got meditation training. It says retreat, just meditation, okay? And on the left with the control group. And what we're measuring is telomerase. Statistically significant increase in telomerase in the group that was doing meditation, that was trained to meditate, okay? Pilot stuff, it's a little old, but still I haven't seen or heard of definitive stuff yet, but it may be coming. We all want to be happy and none of us want to hurt. If you've forgotten everything I say, please remember this. We're all of the same in wanting to be happy and not hurt. Every time we meet someone, please remember that. We tend to separate. We make differences based on gender, on race, on culture, on ethnic or country of origin, you know, all these, we make all these differences, right? Separate. This is a commonality between all of us. So please remember that she or he, whoever you're meeting with, just like me, just wants to be happy, doesn't want to hurt. What am I doing with time? We're good. 6, we're good. So why isn't this dog kind of chewing on the boy? He's sticking his fingers in the nose. Why not? Huh? Trust. They're good friends, genuine friends. They trust each other. This is powerful in medicine. If your patient doesn't trust you, forget it. You can be the best technician. You can be the world's expert in whatever disease you're dealing with. If they don't trust you, forget it. Not going to work. Okay. So trust is critical in the relationship that the doctor has with the patient and that the patient has with the doctor. Okay. This is Ishinomaki. It's a place in Tohoku. Who's my Japan? Who is in Japan? Yes. I've been there a number of times. There was a massive earthquake in March 11th, fairly recently, was the anniversary, 2011. And a few months later, His Holiness the Dalai Lama visited that. It's the whole northeast coast of Japan on the Pacific side. And the tsunamis came in after that massive earthquake. And in Ishinomaki, they unfortunately made what turned out to be a very bad decision. They went down, took all the students, elementary school, took all the students and the teachers and sheltered in a building that was lower down, and it got washed away by the tsunami, and they all died. 20,000 people perished within probably hours from the tsunamis. And His Holiness the Dalai Lama went to visit there. And when he was leaving, this little boy walked up to His Holiness. And normally, there's all kinds of security around him. His own Tibetan security, the Japanese security, and they wouldn't let people just run up to him, because they don't know it's, And it turns out that no one interfered. They hugged, and it seemed like His Holiness knew what was going on. We found out later this boy had lost both his mother and his father in the tsunami. So this is unconditional compassion, just compassion. Unconditional love. This is a buddy and a piglet, right? They just love each other. It doesn't matter. Just love. Okay, I'm looking at the faculty and they're smiling. I'm looking at the students and they don't have a smile on their face. I know being a medical school student is hard. I've been there myself. I can appreciate it. I know it's hard. We're trying to change it. We're trying to bring more love and compassion into medical education. It's slow. There's a lot of resistance, but we'll get there. This is a book. I guess I'm the author. No Fear, No Death, written a few years ago. It's about the things we're talking about compassion, about empathy. And I am going to return to that theme before I finish, of moving beyond empathy to compassion. I'll come back to that in a moment. Nagarjuna's wisdom. It's a deeper dive into the Buddhist wisdom about who are we on a deeper level. Have anybody ever been worried, or not worried, but thought about that? Who am I? Yeah. So this is a deep dive from a Buddhist perspective, and a couple other books in Japanese. I didn't put them up here because they're in Japanese. This is a book by Treziak and Mazzarelli, 2 docs. One's an ER doc and one is in the administration. And they both do research somewhere around the East Coast, Connecticut area. I forget exactly. And they were both kind of naysayers on the question, is compassion relevant in healthcare, either education or the clinical side or research? And they were both naysayers. They didn't think that it played a role. They thought it was too wishy-washy. But they had a little doubt. They thought, well, maybe. So they decided to research it. They wrote this book, came out a couple of years ago, I think in 21, I think. I don't have the date here. I think it was 21. And they went through all the literature and pulled out all the articles on compassion, the research on compassion. And they concluded that it's very important in healthcare. It's a really good book. It's written well. They mostly give the references. So it's a lot of research papers, but it's mostly in the references. In the actual body of the book, they're kind of more just talking about it. So it's a good resource and highly recommend it for medical education also. Okay, so we're a little bit connected, on the internet. This is our altruismmedicine.org is the website for our nonprofit called Altruism in Medicine Institute. We're based in Pennsylvania, in Pittsburgh, offices in the Warhol Museum. And we've been doing this now for about 9 years, I think, from that institute. So my coming here is from Altruism in Medicine Institute. And I guess I'm the founder and the president. I have a Facebook site. It's a public figure in my name. I did a post this morning. Today's Monday, right? Yeah, today and Monday and Friday, teaching, kind of stuff we've talked about this last hour. And so you're welcome to have a look at it. We have there's a Wikipedia site, there's Instagram, and there's also LinkedIn. And this is what Wayne was mentioning. Here's the name. It's AmyCare, capital AIMICRE. And it's available for free on in the Apple Store and the Google Play Store. And it's all about cultivating and training deeper or more compassion and mindfulness, both. Within that, we have developed 2 courses for doctors and nurses, CME and CNE. So you can receive actually 12 hours, 12 category 1 credits for continuing medical education, and the same for nurses for continuing nursing education. And I think it's time for me now to talk about moving beyond empathy to compassion, the title of the talk. And then I'm going to open it up. We'll have almost an hour, which is great. We can, we'll have some question and answers. We'll do some meditation, and then we'll see what else. Good. So empathy, let's define terms. Empathy is standing in the other person's shoes. That's what we often say. So the problem with our heart is open. We're trying to help. There's wonderful stuff. The problem is we're too close. We're actually enmeshed, to borrow from addiction literature, right? We're too close. And we're also too emotional. And as a result, we tend to inadvertently, not by choice, we take on the suffering of the other person. And we're doing that day in, day out. We usually don't recognize that until we get burnt out. So once we start doing that, practicing empathy, taking on the pain of the other person again and again, we're on the road to burnout. So how do we prevent that? How can we not get burnt out? Or if we are burnt out, how can we ameliorate or reduce our burnout? And that's where compassion comes in. Compassion, the heart is still open, but we're not in the other person's shoes. We take a half step back emotionally. Right? Heart's still open, but we're not so close. And a result of that, as a result, we will not, or much less, take on the suffering of the other person. And therefore, practicing compassion rarely leads to burnout. Right? And can help reduce some of those early burnout symptoms we may be having from practicing empathy, or of course from the high stress levels of our profession and our medical education. Okay, there are a number of contributing factors. Empathy is one, and an important one. So we want to try to move beyond empathy to compassion. After I say these things, almost always there's somebody who comes up and says, well, how do I do it? You just have to try it. Remember what I said, when you're in an empathetic situation, you feel you're being too close to the patient, just try to emotionally step back a little bit, not closing your heart, keep your heart open. Okay, just practice it, you'll do it. now that you know what you need to do. Okay, good. I think the last slide is an ending slide. Let's see. Yeah, thank you. So let's transition. Let's do some question and answers, please. And I don't want you to feel like, oh, I have a question, but it's going to sound really stupid, so I'm not going to ask it. Please don't feel that way. Anyway, from my perspective, no stupid questions. So please.
Can I go ahead and start with some that were on the chat? Dr. Kerzin, somebody said, thank you so much for bringing up Compassionomics, one of their favorite books.
Cool.
Somebody else wants to know, how do you find compassion training? Is there a certificate? Are there educational resources for compassion training?
Yes, yes, there are. I'm not aware. There are some. AmyCare at Stanford, they offer some certificates. It's the Center for Compassion, Altruism, Research, and I think Education. It's CCARE, AmyCare at Stanford. I think they do offer some certification. This Amy app is designed to do just what you're asking. That didn't work. The last one on the bottom, AmyCare, is designed to do just what you're asking, to help train compassion. We do have, if you're a doctor or a nurse, you can get CME or CNE credit for that. But currently we don't have otherwise we don't have a certification program, but that may be coming down the line. We've developed this with a group of AI people out of Washington, DC. So it's very dynamic, it's changing. We're upgrading and improving all the time. We're currently working on a conversational AI component that would be like a companion to help you navigate through the app to find exactly what you want and maybe some nudges what you need, what the AI is telling us you might need.
Thank you so much. We have another question. Somebody says, I would like to hear more about the training or orientation on meditation given to the depression participants. So was there an opportunity for follow-up after a few days of meditating to answer their questions or to help them overcome any blocks? And were they given some formal training on meditation?
Yes, they were given formal meditation on training. And if you may remember, it's called MBCT, which is a program developed in England, I think out of Oxford. I'm pretty sure out of Oxford. And it's mindfulness-based cognitive therapy. It's essentially a focused or concentration meditation. And they were given instruction on how to do that. I'm not sure if they had a time when they could get their questions answered. You'd have to go to their actual study to find that out. I don't know the answer to that.
We have another question. Could you list the books that you mentioned? They're just having a little bit of a hard time seeing the slides on Zoom.
Sure.
We will be sharing all the slides and we will be sharing the recording as well with participants. But we'll let Dr. Kerzin go ahead and mention those books again.
Sure. I mentioned 3 books. The first one is called No Fear, No Death. I'm the author. And the second is called Nagarjuna's Wisdom. Nagarjuna was kind of seen as the second Buddha, lived about 2,000 years ago in northern India, highly respected as a scholar and a practitioner. And this is about his seminal work called, it's the fundamental wisdom of the middle way. And this is my book is a commentary on that, at least 5 of the 22 chapters, 5 of the 27 chapters. And so that's called Nagarjuna's Wisdom. That's a deeper dive into the Buddhist wisdom. So you're welcome to have a look at it. But what I would recommend is if you do have a look at it, if you find that some things are a bit confusing, don't worry. Just looking at it, getting familiar with some of the terminology can be very helpful with your lifelong discovery and exploration of who am I. And then the third book was written by Tersakiak. I always pronounce his name wrong. It has mostly consonants, not vowels. And then Mazzarelli, Hudox, and that's called Compassionomics. And that's all about collating the research on compassion and some on mindfulness also that's available in the healthcare and medical literature.
Thank you for that. And we will go ahead and go to the live audience, and I'll bring the microphone around so that people on Zoom can hear your question. But if anyone has a question here in the audience, I'd love to hear from you.
I love it when the students raise their hands for questions. It's fabulous.
Thank you, Dr. Kerzin. My name's Tyler. I'm a fourth-year medical student here at Creighton. And you spoke a little about taking a step back, and that is described as kind of the transition from empathy into compassion, if I am correct. And in our medical education, I think a lot of times empathy is emphasized over compassion in that, you share your suffering with your patients. And in many regards, I think it's taught that that is the optimal or best way to take care of your patients is to empathize with them and share in their suffering, because it allows you to kind of, I think it's taught that it allows you to take care of them in a more holistic and caring way. So when you say taking a step back, that almost seems like counterintuitive to what we've been taught. But could you speak on how to still take care of the patient holistically while taking a step back?
Sure. First thing I'd say is don't believe everything you're taught in medical school.
That's true. That's true.
I am a faculty at a number of different medical schools. I think the notion of, first of all, the name compassion is troublesome. The word actually is Ningje in Tibetan and Karuna in Sanskrit. And the English translation, which is often compassion, is not full, doesn't really translate those original terms accurately, fully. First thing. Second thing is the notion of compassion in this broader sense is probably not known to many doctors who are professors in medical schools. Third point, empathy is wonderful stuff. Don't get me wrong. Because we are open, we're trying to share our lives with the patient's suffering. That's all wonderful stuff. The problem is there are pitfalls with that. That's what I'm suggesting. And the pitfalls are that if we do inadvertently take on the other person, the patient's pain, and do that again and again, then we end up often burning out. Feeling emotionally exhausted, having less interest in our work, and losing a sense of meaning in our work, the classic definition these days of burnout. Now, I did say taking half a step back, not a full step. And it's not a physical step, it's an emotional step. And what it means is not to be so close to the patient. Okay? Heart's still open. We're still understanding their suffering, but we give ourselves a little room so we don't take it on ourselves and end up in burnout. The other benefit is when we're empathetic, we sometimes get too emotional. I mean, I'm a big guy on expressing emotions. That's not the issue. But if we're too emotional, we lose some of our cognitive faculty to help the patient. So by stepping a half step back emotionally, we have a little more clarity of mind. We're a little less emotional. We can bring in some of the more cognitive stuff to help reduce the suffering. So I think those are kind of the main points. Yeah, and in all fairness, I don't mean to put down the faculty that are, telling you about, the benefits of empathy. I agree with them, but there are pitfalls, and compassion, the way I've described it, there are many ways, because again, we have a terminology issue here, but if we talk about it the way I described it, is much more beneficial, not only for the physician, also for the patient. Because if we get burned out, we're not very good for the patient. But it's an excellent question. Thank you very much. Please.
So I'm Shraddha. I'm actually an attending physician, but I'm sharing the table with the students. They've been graceful to accept me on the table. I was actually going to piggyback on what we discussed right now. At the prime time in COVID, I was seeing almost 20 patients with COVID, and it was very difficult to extend compassion and not be burned out. And I've been practicing mindfulness for a while now. Still a beginner, I would say, completely. But at that point, unintentionally, I think so, I took a half step back. And I'm going to throw out some words which might be Western versions of mindfulness, but extended some loving kindness or compassion to my patients. And I could feel the difference when I was extending empathy, because I was in a situation where I was seeing a lot of patients with end-stage disease, where I could not help them out. And being empathetic towards them was making me burned out. But when I could extend loving kindness or compassion, my perspective changed from trying to help and fix everything to just extending what I could offer best, was, these offerings of loving kindness or get well soon, or may you move ahead in your journey. And I could feel that my burnout, or awareness of that burnout was decreased significantly. So really, thank you for that expression. And I don't think so I understood it so beautifully, but the way you said, taking a half step back and just moving from empathy to compassion. Thank you.
Yeah, beautiful. Thank you very much. When I talk to medical students or to doctors, both groups, sometimes the discussion that we have is about death and dying. And particularly in that discussion, so I think your experiences overlap with, moving beyond empathy to compassion and how to handle the end stage or the dying patient. And in that context of a dying patient, what I often talk about is, number one, to show up. We tend not to, because we feel like we're a failure, because we feel like we don't have anything to offer. But in fact, death is natural. All of our patients at some point are going to die. We are all going to die. And when we're having a patient that we feel, and the experts and the team, feels that there's nothing more we have to offer, a lot of doctors then don't show up because they feel like a failure. Actually, that's one of the most important times in that patient's life and that family's life. So we must show up, and show up a lot. And then people say, well, I don't know what to say. I say, don't say anything at all. Just show up, be there. Okay. Put your phone away. Try to not be so distracted. Try to be there with the patient. Then they say, well, the patient's in a coma, or they can't hear, they're not able to really have a discussion. Doesn't matter. They can feel. The family can feel, family can hear. So be there. Try to be as open as you can. You don't have to say anything. And then thirdly, I will talk about with them to be natural, be real, be yourself. We forget that a lot in medicine, but just be yourself, be natural. And that really helps the patient and family a lot. If they want to talk, something will be said by the dying patient, or if they don't want or they're not able, the family may ask something. You don't have to talk. Try to have an open heart, try to develop some compassion for what's happening for this person dying and the family is already or will be suffering the grief, the loss. the best you can. So I think you were commenting on some of those things also, and it's very, very important. If we feel that we have to fix it, then, we're going to feel like a failure in a patient that, we can't do anything more for. They're going to die, right? So to be able to recognize that's part of the natural life cycle, we're not a failure. We've done everything we could. Our team has done everything we can. And this person is just at that point where they're going to be dying. We don't walk away. We stay around because that's really important. Yes, please. We have the mic. Yeah, thanks.
Hello, I'm Rebecca. I am not a student or a faculty member. I'm a staff member. So
Fabulous. Thank you very
my
much for
question
coming.
is taking a step back when thinking about burnout and that half step back to be compassionate. How do you advise an individual to articulate and build boundaries, maybe when their team members are burning them out with their energy? Does that make
Yeah,
sense? How do
makes a
we,
lot of
how do you
sense.
continue to be compassionate when maybe your team isn't?
Yeah, wonderful question. Thank you. We have to protect ourselves. And it depends on the level we are in terms of our understanding of who we are. When we're one of these advanced spiritual practitioners that realizes that we're not really who we are, then we don't take things personally. Then boundaries are less important. But very few, if any of us, are at that level. I put myself in that category, not there. Okay. So we have to build boundaries, take care of ourselves. And we do it with the intention of staying well so we can continue to do our job well. And that by doing that, it's going to ultimately have a better impact, better health, physical, mental, and satisfaction for the patient and the family. Okay. Even if we're not directly doing that medical care. So with that motivation to build boundaries as healthy is good, very helpful. We don't want to make the boundaries too high or too thick because then we've cut ourselves off. So that's kind of an art where we have to figure out how high and how thick and when. Sometimes we don't need much boundary. Other times, if we're around certain colleagues or whatever, we need more boundaries, protect ourselves, perfectly healthy. So that kind of segues into the notion of, well, what is compassion? So many people think compassion's weakness. It's wimpy. I'm not going to be compassionate. I'm a tough, strong doctor, right? Compassion is the opposite. It's about as strong as you can get. It's about as most courage as you can muster. To be arrogant's easy. That's weakness. That's actually often an expression of insecurity. It's not good stuff for yourself or for others. Compassion, on the other side, takes a lot of courage and strength. Look at some of the compassionate people we have or have had as leaders. Look at Saint Mother Teresa, tiny little Albanian woman, tough as nails. Yeah. Picking up people dying in the streets of Calcutta, laying in their excrement, taking them to the Sisters of Charity, bathing them, cleaning them, giving them clothing, food, shelter, and love. This is strength. This is courage. Look at Nelson Mandela, in jail a lot, leading his people out of apartheid non-violently. Look at who recently passed Archbishop Desmond Tutu, who was a very close friend of His Holiness the Dalai Lama. Yeah, also the same, trying to get rid of apartheid and do it bloodlessly, and they were pretty successful. Look at Martin Luther King. Incredible what he did. And he was all about love and compassion. So strong, so courageous. Look at His Holiness the Dalai Lama. So people that are truly compassionate are strong, courageous people. People that are arrogant, they come and they go. Yeah. We don't remember them so well. Yeah. Because when you're arrogant, you're putting others down. Nobody likes to be put down. So good friends, genuine friends walk, right? Yeah, those that want something from that person, well, they may stick around, but it's not a genuine friend. Also, when you're arrogant, you feel you know everything. You don't learn anything anymore. You don't listen to people. You don't read. You don't really listen. If you're in a conversation, you're already forming your response, not listening to the other person. Right? You're not growing. So these are some of the pitfalls of arrogance. And to practice compassion takes a lot more guts, a lot more courage.
Got a question right here.
It's okay
Please.
to keep asking questions? Yeah. So Cecilia Plain, I'm as well a fourth year medical student. My question is about humility. And you're I was thinking of it earlier, but now it feels like you're contrasting arrogance with courage. And I would probably contrast arrogance with humility, which isn't opposite or not to courage. But my question was whether there are specific teachings about humility. And I could also see humility having a role in the transition from empathy to compassion, where you're not centering yourself in the patient's suffering. You're kind of removing yourself from the suffering because your role is reduced.
Yeah, exactly. So this little scenario about the strength, requiring strength and courage to be compassionate, we could have substituted for humility. Exactly. And humility is the opposite of arrogance. You're right. So one of the areas I didn't talk about, but let me mention it just here because it's on point. I talk about emotional hygiene. So you know the word hygiene, right? It comes from public health. It's to kind of clean up, right? And you know what emotion is. So emotional hygiene is cleaning up your negative emotions, your harmful emotions, okay? So emotional hygiene involves some of the major destructive emotions and how we can transform them. That is not suppressing, but actually change or transform them into their healthy opposites. So for example, anger. Everybody here gets angry sometimes, I'm pretty sure. Most of us, maybe all of us, don't like getting angry. Yeah. Sometimes we think, okay, it's emboldening me. I mean, I'm a little powerful when I get angry and I can get something accomplished. Okay. But generally, we don't like getting angry. It throws us off. And it may well hurt the other person if we're getting angry with somebody else, right? So how do we, so what is the healthy opposite to anger? Tolerance, patience. Okay. So how we make that transition is something that I teach a lot. And there are some, so first, we have to recognize anger early, because when we're full-blown angry, we can't work with it. We're blown away, right? Blown out of the water, I think. Yeah. So we have to recognize early anger. You know, when we're frustrated, irritable, we didn't sleep well, physiologic stuff like tremulous, we're shaking. Some people get very loud and talk a lot. Other people, the opposite, they kind of withdraw in terms of their speaking. We may get, you know, a little bit of, not really palpitations, but tachycardia, the heart's going boom, boom, boom. Okay. Breathing, you know, tachypnea, we're breathing fast. Okay. So to recognize through mindfulness by looking inside what's happening in your inner life, you know, check in sometimes, even if it's just for a couple seconds, check in. And when you notice some of these early signs of anger, tell yourself, I may be getting angry. Then you apply a method. One method is imagination. You can imagine that you're a crystal ball. This is another one. You imagine that your pre-anger is a crystal ball. And you imagine you drop, you know, the crystal ball onto a stone or cement floor, and it shatters into 1,000 pieces, along with your pre-anger. There are other methods also. It won't work the first time. But if you're persistent, it'll start working. Your intensity and frequency of getting angry will lessen. This happened to me. Second is jealousy. So what's the healthy opposite of jealousy? Gratitude. Yeah, gratitude or appreciation. Rather jealousy is putting the other person down. We do that all the time. Usually we don't recognize it. But what happens is it constricts us a little bit. We don't feel so well, so open. So jealousy is not healthy. When you recognize through your mindfulness checking in, oh, I'm feeling jealous, you have an opportunity to let it go and to practice appreciation or gratitude, but just by knowing that. Okay. So it's easier to transform than anger, but you got to recognize it. And then third is arrogance. So the healthy opposite of arrogance is humility. So arrogance is, it's a little like solitary confinement, being in prison, right? Because you lose all your good friends, you're cut off. Okay? Because you're being arrogant, you're feeling better than the others, you're putting everybody down, and people don't like it, they walk away. You also feel like you know everything, so you stop learning, stop listening. Right? So once you notice that you're in an arrogant mode, mental state, get yourself out quick, because once you get habituated to that, life gets very lonely and very difficult. And so, then you have the opportunity to practice humility. So the great people that I mentioned about compassion, each one of them we could say are humble people. And again, humility is not weakness, it's not wimpy, right? Tremendous courage and strength. So thank you for that. Did I answer everything you? Good, thanks. Please.
So I love the slide you had about slightly reducing our expectations. And in education, I see learners, especially a lot that have expectations that are not realistic. We all have those of ourselves. But there are times in our lives when we all make mistakes that are real. And they may be small, or they may be a grave mistake that affects ourselves or someone else. Do you have any advice on how to respond in those situations with compassion when someone really does not meet whatever the standard of expectations is?
Compassion is not always weakness. I keep saying this. Sometimes there's tough love, a little bit like with an adolescent son or daughter, where the soft stuff doesn't do it, right? They're still being they're doing things that where they're going to harm themselves or harm others. And you want to intervene with more force, not anger. You don't hit them, but you're strong. It's a little bit like that. So compassion is the same way. A lot of compassion, when the situation requires more strength and firmness, then we have to get firm. So for example, if someone is a student and they're making mistakes repeatedly, then we have to be direct with them and talk to them about it, and probably set up some guidelines for them to continue, whatever in the education or whatever. And also some ways to help improve or to get around those mistakes would be very helpful if we can. I think also, we kind of, as educators, we kind of take for granted, we kind of assume that everyone's coming with a clean plate, but that's not true. Some people are living in cars. Actually, some people don't have running water or electricity. Some people have a lot of drug use in the family, so they have parents that may be there, one or two, but are not really there. Some of them are having some kind of abuse. Could be physical, sexual, emotional abuse. So not everybody's coming with a clean plate. So to recognize that, I think, is also important. There may be something behind those mistakes that we're not seeing, that you want to try in a compassionate way maybe to explore a little bit. And if you find some of that stuff, use a team approach, maybe social work, psychiatry, psychology, or whomever, to help ameliorate if there are some significant issues going on that may contribute to the mistakes. There's a saying in Tibetan, and I found out that there's similar saying in Japanese, actually. And it's, so in English, the translation is 9 times falling, or you could also say failing. It works with the translation. And 9 times picking yourself up, moving forward. So we're all making mistakes, and that's part of being human. Sometimes they're inconsequential, sometimes they're very consequential. But for us that are making the mistakes, not to give up, be blown out of the water, but pick ourselves up, keep going forward. Obviously, try to learn from the mistakes and see if you can rectify next time you're in that situation. It's not an easy one. I'm not sure that I fully answered the question, but that's kind of what, yeah. You want to, are we good? Okay, thanks. Yeah, good.
Any other questions? We do want Dr. Kerzin to be able to do some meditation with us. So
Yes.
if there aren't any other questions and we don't have any more online, then we'd love you to be able to do that with us.
Let's do that. Any other questions before we segue to meditation? Okay, let's talk about, let me talk a little, we have a half an hour, I think. Let me look and see. I can move this along. We have 24 minutes by my clock. Let me say a few words about meditation and then we'll meditate. So meditation basically is training the mind, training it in a healthy way. Okay? Training the mind in a healthy way. And there are 2 types of meditation. One is concentration, and the other is analytic, or sometimes we call contemplative. So far, when we've talked about mindfulness and when we've talked about meditation, we've been talking about concentration meditation. Okay? It's the first type. There are 3 categories of objects that you can use for your concentration meditation. The first is the breath. That's the most common one that we use, and we're going to use that one. We're going to concentrate at this point, at the base of the nose. And if we can identify the passage of air at that point, as we breathe normally, we might be able to notice that sensation of the air at that point. If we don't, no problem. As they say in Japan, daijoubu desu. No problem. We just focus our attention at that point. The second type is an image. Okay, so it's imagination. We're not looking at a statue or a painting, but we're imagining. And if you're Buddhist or have an inclination to Buddhism, it would be of the Buddha or some form of the Buddha. If you're Christian, it could be Jesus Christ. If you're more scientific minded and like the physics, it might be Albert Einstein. He's one of my heroes. And we imagine that image, the size of the hand from the palm, base of the palm to the fingertips. It's your heart chakra in the middle of your chest, facing the same way you are, facing that way, right? Or on the top of your crown, not sitting, maybe 1 finger breath above, so kind of right there, facing the same way you are. When we start getting good at this concentration meditation, you can reduce the size to the size of a thumb. When you get really good, they say you can reduce it to this. You can reduce it to the size of a sesame. and get really good at your concentration. The third kind of area that we can use for an object, and here we're pressing the word object a bit. It's the mind itself. So the mind, that's a long topic, and I don't want to go into it now, but basically it's experience, it's thinking, it's intuition, it's feelings, it's a mood, et cetera, et cetera. And the two essential qualities of mind are clarity, things are clear. Now we're talking about the mind itself, not the object. The mind has a sense of clarity and aware. We say a rock or a table doesn't have awareness nor clarity because it doesn't have a mind. Now, my Japanese friends, they beg to differ. And some traditions outside of Japan also, I think some indigenous cultures also believe that there is kind of an awareness, if not clarity. In Buddhism, it's mainly it's animals and people, and then other realms, but not including the plants or rocks. In Shinto, in Japan, they believe that either in the rock or behind it, or the tree or behind it, somewhere nearby, there's some kind of sanctity, some kind of, deeper or higher presence, something like that. Okay. Now, mind, like everything else, is in a continuum. So everything is changing moment to moment, right? We know that as doctors. I mean, just look at the blood flow, right? In the body, changing moment to moment. Okay? Or the, along the nerves, the neurons, the impulses, changing moment to moment, right? We know that. We know as chemists or physicists that the electrons in an atom are changing moment to moment. I mean, they're whirling around, supposedly. If you buy that model of the atom, it's changing, but yeah. In fact, I'll give you a fact. 99.999999999 to the 12th power of the atom is empty space. The protons, neutrons, electrons are infinitesimal with respect to the whole space, if you will, of the atom. So why don't you fall through your chair? Anyway, that's another discussion, but so let's come back to mind. So we become aware, so we identify awareness for this third category of the focused meditation. Okay? And what that meditation is like, I briefly mentioned it earlier, everything is wide open, but no sticking, no grabbing onto anything. So your senses are wide open, everything that you're seeing, hearing, maybe smelling, taste, touch, tactile, and any thoughts or feelings, sensations coming up from the mind side. All that, you allow everything to come up, but you allow it to come and go. You don't block anything, you don't stick on anything, you don't make a story of anything. So you're just kind of wide open, you're just there, like this. And then the second type of meditation is analytic or contemplative, where we actually do some thinking. So some of you have heard that meditation is get rid of your thoughts. Not all meditation, okay? So here we try to identify with a healthy, positive quality, maybe love, compassion, kindness, generosity, impermanence, or that momentary change. Everything is in a continuum, like the mind. This table is in a continuum. Every moment is different. We don't recognize that, but if we think about it and get the EM, the electron microscope, we see everything's, everything is in a continuum, momentary change, as the mind is. sort of recognize that, to sort of become one with that notion of impermanence, change, would be one topic for analytic meditation. Wisdom, to recognize that things are not solid and independent as they feel and seem. Okay, just very quietly say your name to yourself. Go ahead, do it quietly. Is there a sense of kind of me here? Probably. Might be physical, it might be more emotional or mental. But we don't get a sense when we just look, not thinking, when we just look, we don't get a sense of mother and father. Without mother and father, we wouldn't be here, right? Without with our family, all of our relationships, that doesn't come up, that interdependence. It does when we think about it, but when you just normally look, it's not there. Okay. So recognizing that mistake, then we work on what we call the wisdom, who we are accurately. That's another object. So that's another object of our contemplative meditation. So we think about, let's say we take kindness. So we think about, what is kindness? How can I be more kind? We have certain ways to kind of go about that. And as you do that analysis, that thinking, when you start to feel the kindness, you stop your analysis and you stay right there with that feeling of kindness. So you've kind of become kindness, at least for that moment. Okay. When you lose that, then you go back to your analysis. So you go back and forth. So let's do the very first meditation. We're going to meditate on the breath at the base of the nose. So please sit up straight. Shoulders relaxed. Okay, good. We're going to do this with the eyes open, glancing down like this. Mouth closed. Normal breathing. Try not to stare. You might be seeing a table or a chair or in front of you in your field of vision. Try not to stare at it if you can. Sometimes that takes practice. You can put your hands with your left hand up like this, palm up. Right hand, palm up, going the other way. Okay. And then your thumbs making a triangle. Good. And then just relax it in your lap. Relax your shoulders again. Good. Very good. We're going to put our attention right here at the base of the nose. Okay. Put your attention, your awareness right there. You're going to get distracted most likely. There'll be a sound, sensation in your body, thought. Okay. When you get distracted, tell yourself, come back. Just come back to the base of the nose. And every time you get distracted and you come back, you're actually training your mind to be less distracted. That's actual meditation. Okay. We do this with our eyes open because it develops slowly over time, more mental clarity. Okay, good. So I think we'll do this together for about 10 minutes, and I will be the timekeeper. And I usually like to look this way, but I don't want to look at somebody. You'll feel uncomfortable. I'll look this way. So I'll ask you to please start, and then I'll ask you to stop, and we'll do it for 10. Please stop your meditation. So how was that? Anybody fell asleep? Anybody have monkey mind? Mind's just jumping around a lot. We tend to have that a lot. Yeah. You know, what you do in the other 23 hours and 50 minutes in your day obviously has a big influence on these 10 minutes, right? So people say, well, how could I not sleep? How can I not have this mind jumping around? Well, obviously what we do in our other time of the day has a big influence. So, you know, less caffeinated stuff, you know, more exercise, better sleep. I know, easy to say, hard to do, but try a little bit, you know. And keep doing this meditation. Those of you that are interested, every morning, this is the one I'd like you to do, okay? And even if it's for a couple minutes, No clock, no alarm clock. That's a big distraction. Okay. No judging. So most likely for most of us, afterwards, we're going to have a thought or a feeling like, oh, I'm a great meditator, you know, or I'm terrible at this stuff. My meditation was so bad, you know. And so if we do that kind of stuff, we're not going to continue, right? So if the judgment comes up, just let it come up. Try not to engage it. Don't make a story about it. Just let it come, let it go. Okay. That's important. That's also important in our lives. When we have that judgment, negative critical judgment coming up, to allow it to come up, recognize it for what it is, not engage it, and just let it go. And the more we're able to do that, those kind of, you know, putting ourselves down, self-criticism, it's a little bit narcissistic. It likes the limelight. And if we don't pay it so much attention, it'll start to go, you know, down. That's it. Thank you very much.